Well, to begin with, I was just completely surprised because I had no symptoms. If I hadn't done the screening test to this day, I probably wouldn't have followed up or been aware that anything was going on at all. But once I was, had started on that process, everything just fell into place so perfectly. And all the staff were so good at telling me what was going on and what was going to be the next thing that happened. And I think one of the things that really impressed me, because I had bowel, lung and liver, so I had 3 surgical teams involved, is the way that they communicated so effectively with each other and with me. And there was never a question of not knowing what the liver surgeon was going to do, or the lung surgeon not knowing what had already been done by the bowel surgeon or something like that. And all the nurses were absolutely fantastic. And everyone, this is one of the things I always say to people, is that I think is absolutely outstanding, is I never called anyone, because they always gave a number to call if you had a question. I never called anyone, left a message on the answer phone, and I wasn't called back the same day. And I think that is truly amazing. And it's so reassuring, because the one thing I think people, on the occasional times where you do get a bit worried, is when you're thinking, what's going to happen next? If you've got someone who's telling you what's going to happen and you won't hear about that for 2 weeks, that's fine. But if you think you're going to hear that more quickly than that, then somebody might be worried. So that communication, which they do so well, I think makes such a difference to the whole experience, really.